Cybersecurity Today is brought to you by Optiv, your cybersecurity solutions integrator.
Canadian restaurants are offered a security assessment service. Microsoft has a new theory about how security operations centers should be designed, and how hacking medical devices poses the risk of killing hospital patients. Welcome to Cybersecurity Today. It's Monday, September 3rd. I'm Brian Jackson, filling in for Howard Solomon. Howard will be back on Wednesday. Restaurants Canada announced last week that it will be helping its members with improving their cybersecurity. A deal with Toronto-based security vendor CyberRisk Check will provide restaurateurs access to an online analysis tool. It will help assess risks and then provide an action plan to resolve issues. Restaurants handle a lot of data that cybercriminals are hungry for, namely customers' credit card details. But many restaurants are also small businesses that might not have the resources or talent to defend against cyber threats. The average small business that suffers a cyber attack loses $180,000. So it's a good idea for industry groups like this to team up and offer services across the board. Of course, in this case, once the security assessment is done, it sounds like the restaurant owner will still need to pay for the services to actually help address the security risks. Are you building a security operations center for your company or looking to remodel your current SoC? Well, Microsoft's cybersecurity CTO has a concept for you to consider: data gravity. Just like large planetary bodies create gravity, drawing objects towards them, large masses of data have similar effects, she says. The bigger the data, the greater its gravity well, and the more likely that apps and services are drawn to it. The closer that an app is to the data, the stronger the gravity and the faster it moves. Now consider the current approach to building a SoC. We aggregate all the log data from our security systems and throw it into one big pile to analyze. This was great in the year 2000, but today there is so much data from so many different sources, it's creating a lot of latency. And you can't be slowing down in the fight against hackers. Therefore, the SoC of tomorrow should apply analytics as close to the data as possible, taking advantage of that gravity acceleration effect. Critical flaws in medical devices could have threatened patient safety. Flaws in the Qualcomm Life Capsule Dataceptor terminal server and the Becton Dickinson Alaris Tiva syringe pump were acknowledged publicly last week. The Dataceptor vulnerability was rated as critical and found in a web management interface used for remote configuration. Attackers exploiting this flaw could have gained access to other medical devices like respirators and heart monitors. As for the syringe pumps, they lacked any authentication requirements, so anyone with access to the hospital network could have taken control of these devices responsible for regulating the amount of medicine a patient is receiving. That means it'd be possible for an attacker to kill a patient by overdosing them and turning off any alarms on the pump. Hospitals connecting any devices to a terminal server or their network must put in place a system to ensure the most recent firmware is installed on these devices. Their patients' lives could depend on it. That's it for Cybersecurity Today. Subscribe on Apple Podcasts, Google Podcasts, or add us to your Alexa Flash Briefing and Google Home Daily Briefing. Thanks for listening. I'm Brian Jackson.
Cybersecurity Today is brought to you by Optiv, your cybersecurity solutions integrator.